Good evening. We are conducting a webinar series regarding solving your sleep for better health. It corresponds to the book entitled Solve Your Sleep for Better Health. My name is Dr. Amy Dayries. I'm a dentist in Roswell, Georgia. And tonight's webinar topic is how sleep is affected by vitamins and minerals. And so without further ado, I'm going to launch into our presentation. And here we go. So in our American modern society, there are a lot of vitamins and minerals that we are not receiving enough of. And while we might not be starving or literally dying from an absolute mineral deficiency like you might have had several hundred years ago, an example of that might be scurvy, when you did not have enough vitamin C and you were on a long sailing expedition around the world. While we might not have things like that full on going on in our modern lives, we do have a lot of mild vitamin deficiencies that are exhibited by many of us, and those can be in the forms of depletions from different pharmaceutical drugs that we take, or just simply we just don't eat enough of certain foods. And so tonight we're going to cover that, especially in relation to particular vitamins that we may not get enough of that directly influence how and how long and how much we're able to sleep. And so I wanted to touch on the types of vitamins and where they are absorbed in our GI tract. And what we've covered in an earlier webinar is when we have gut inflammation, we frequently are unable to absorb the vitamins that are in our diet like we should, even if we are eating them, because sometimes we don't have the gut bacteria present anymore that best absorb those things, or things don't get absorbed because other particles are being absorbed instead of, or the cell walls of the gut, the tight junctions of the gut are being inundated by these other toxins. And so we're just not having good absorption of these things. So in particular, you might notice that we absorb a lot of our magnesium in the upper part of the small intestines. Magnesium is one of these components that's very important for sleep. Copper is another one. It's absorbed through the stomach. And we're going to be talking about some of our vitamin Bs, which again are absorbed in the mid-third of our small intestines. And as we get further down into the ileum, we have vitamin D and vitamin K down into the large intestines. So we also have vitamin K up here in the ileum. But we need all parts of our gut functioning well. So for instance, when we're on certain types of pharmaceuticals, perhaps like a stomach acid blocker, like a Pepcid, that can actually affect those vitamins being absorbed, and so therefore we end up with a deficiency in that type of vitamin. So we'll review also pharmaceuticals that can cause or impede the absorption of vitamins. So without further ado, our first one that we're going to talk about is vitamin B12. You'll see food sources in this picture of vitamin B12, including meats and cheeses, mushrooms, and it's an essential vitamin we cannot make completely on our own. We have to get it from our food sources. That's why a lot of vegetarians or vegans actually, they must supplement in some way with a vitamin B12, and a lot of them will be lower on B12 because some of them don't supplement as much as they really need for their bodies to get the amount that they need. And if you are low in B12, you'll have symptoms like tiredness, dizziness. You may have really pale gums or sort of a washed out look to your skin. You may have an irregular heartbeat, vision loss, you may feel depressed or fatigued, and you may have a history of digestive or diarrhea types of issues or constipation kinds of issues. And we reviewed the types of foods that contain B12, which are your meats and your eggs, dairy products, and fortified breakfast cereal. Vitamin B6 is another one of these types of vitamins. And again, you're going to find vitamin B6 in your meats and in certain vegetables or foods like spinach and bananas. signs of B6 deficiency would be cracked lips, skin rashes, moodiness, tiredness, and a tingling in the hands and feet. You can see sometimes that also as a crossover symptom of somebody who has diabetes. And foods that contain vitamin B6 would be your porks, meats, fortified cereals, again, whole grains, eggs, vegetables, soya beans, and ricotta cheeses. Vitamin D would be another vitamin that is needed really for proper sleep. And when you don't have enough vitamin D, you're going to have muscle weakness and inflammatory diseases such as cardiovascular disease, diabetes, cancer, and multiple sclerosis. Foods that are containing higher amounts of vitamin D would include your fish oils, different types of cooked fish, but also, you get a lot of your vitamin D from sunlight and sunshine. So people that need to supplement with vitamin D are going to be your people that take statin drugs, and also those who might not be able to absorb, they may have intestinal issues, so they may have trouble absorbing that vitamin D. And the ones that have something called pregnane X receptor, and that's something that can be tested by your doctor. Or if you take some of these drugs, they can actually activate this pregnane X receptor, which disable your ability to absorb vitamin D very easily. And when you're born in the Northern Hemisphere, or actually really most parts of the world, most of us are not outside enough to be able to make or absorb enough vitamin D through our skin. So, and you're also taking these different types of drugs, which can include antibiotics, antiretrovirals, and herbal medicines like kava kava and St. John's wort. We are actually inadvertently also inhibiting our ability to absorb vitamin D. And then vitamin K is going to be contained by a number of oils and green leafy vegetables, generally speaking. And we need vitamin K to enable us to form blood clots. So somebody that has signs of a vitamin K deficiency, they have trouble forming blood clots. They may bruise easily. A lot of times they seem to run into problems with alcoholism, but actually the number one type of patient that's going to be deficient in vitamin K is going to be an infant. So frequently you'll see infants being supplemented at birth. And if you were to supplement with vitamin K, these might be the guidelines for supplementation of vitamin K. And then iron is another one where you're going to be receiving a lot of your iron from meat sources and green leafy vegetables, and also nuts or proteins. Men really shouldn't be supplementing with iron ever, and women really shouldn't be supplementing with a pill for iron after menopause, when they're no longer bleeding out their iron. And when men and women are supplementing later in life, they can lean towards developing hemochromatosis, which is an overabundance of iron, too much iron in the blood, and about 10% of the population of certain world cultures, like the Irish, actually run higher with troubles with hemochromatosis. But if you have not enough iron, you can have issues with fatigue and weakness and pale skin, cold hands and feet, and brittle nails that tear easily. And also a lot of those people will have a bald or a red tongue. Foods that contain iron, we've reviewed a lot of your beans, wheat germ, pumpkin seeds or sesame seeds, squash seeds, some raisins, and meats and squashes and spinaches. But what you won't find if you're taking a pill and you're a child, you won't generally find iron in the gummy type of vitamins. It needs to be a hard chewable type of vitamin. If you're a child trying to, or you're a parent buying iron for your child. And there are also pharmaceuticals that lower iron levels, which would include thyroid medicines, levothyroxine, Tagamet, Pepcid, and Zantac, because the iron is absorbed in the stomach, and that's where these H2 blockers are at work to limit stomach acid. Magnesium is also one of those that can be depleted by taking a lot of H2 blockers on a regular basis. And indications of low magnesium level would be headaches, weakness, dizziness, muscle soreness, PMS, fatigue, just general fatigue all the time, mood issues, and you may not sleep long enough when you have a deficiency of magnesium. Magnesium also keeps calcium in the bones, and that's how it promotes relaxation of muscles, because calcium tends to contract muscles. Foods that contain magnesium would there again be your green leafy vegetables, avocados, nuts, legumes, really a lot of the same types of foods that contain these other nutrients will contain magnesium. But if you're needing to sleep more or longer or deeper, another good way to supplement with magnesium would be to take an Epsom salts bath, or to take either liquid magnesium or magnesium glycinate, sulfate, or citrate over the counter at night before bed. I would recommend a 400 milligram dose, maybe more like 8 to 1200 milligrams if you get migraine headaches on a regular basis. So this is magnesium. Pharmaceuticals, we've talked about these same types of proton pump inhibitors. They actually disable your ability to absorb magnesium because you absorb magnesium in your stomach. And within about a month, most people that take proton pump inhibitors actually lose their ability to absorb magnesium through their gut. So those people would do well to take either a topical magnesium or a soak in the tub with Epsom salts. Other pharmaceuticals that impede your ability to absorb magnesium would include potassium irritating agents like the drugs amiloride, triamterene, and spirolactone, and patients who use digoxin for heart, because that creates a different balance with calcium and magnesium in your bloodstream, and corticosteroids, and also estrogen therapy. So another one would be zinc and copper. And zinc and copper have an inverse relationship with one another. When you're too high in zinc, you're going to be too low in copper. When you're too high in copper, you tend to be too low in zinc. And symptoms of low zinc would be an inability to smell or taste very easily. You'll be the last person to know if there's a fire going on in the building that you're in. You tend towards hypothyroidism, fatigue, again, brittle nails or hair loss, dry skin and hair, and lowered sex drive in women, and erectile dysfunction in men. Foods containing copper and zinc are going to include your meats and shellfish, dairy, nuts, eggs, and whole grains. Remember, zinc and copper are in an inverse relationship with one another. By that same time, let's talk about what low copper would indicate. And you would have sensitivity to cold, pale skin, premature gray hair, brittle or weak bones, and fatigue, memory troubles, vision loss. You just aren't quite with it. Loss of taste, and again, sexual dysfunction. So similar actually to some of the zinc issues. Drugs that deplete zinc include ethambutol, which is a TB drug. So it's not something that a lot of people are taking, at least not openly. But also prednisone is going to deplete you of your zinc. ACE inhibitors, which are a very common drug, which are going to include your low tensin, Capitan, Vasotec, Monopril, Pranavel, Zestrol, Acupril, and Altase. And chlorothiazides, which are an older class of cardiovascular medicines, and hydrochlorothiazide. And also your Pepcid, your Tagamet, these drugs for acid reflux, like we've talked about with magnesium. So generally speaking, the vitamins that are going to decrease how much sleep you need or feel that you need would be B12, copper, and vitamin K. And the vitamins and minerals that would actually make you feel like you can sleep longer, or you will tend to sleep longer when you supplement with those, would be including your iron, your magnesium, and your zinc. And that's really it about vitamins that help you to sleep specifically. And you really need all of those, a healthy balance of all of those. If you want to know what your vitamin D level is, that's going to be confirmed with a blood test. And you should not be supplementing with vitamin D about 10 days before the blood test, because you don't want to abnormally spike it. The other vitamins you really don't typically test for, but in our book, Solve Your Sleep for Better Health, we do go into how you can do some self-detection or self-experimentation. But vitamin D is one of the most important ones. And if you're going to supplement with vitamin D, I would recommend a starting dose of 5,000 milligrams a day until you've had a blood test to determine if that's really an adequate level, because you want your blood level of vitamin D to be at least 70 nanograms per deciliter in your blood. So it's okay if you're over 100 though. And a lot of doctors won't tell you that you're low in vitamin D unless you're under 30. But I hope this is helpful, and we're going to stop and do a little Q&A now about the vitamins that directly influence your sleep. And I look forward to answering any questions you might have. Thank you so much for joining us. We're going to try to do our webinars at 7:30 on Tuesday nights. And I look forward to seeing you all again next week.